Good afternoon, Mayor and Council. It's Chief Heppel coming to you from the Emergency Operations Center located at 2nd and Chambers with your City Council COVID update for the week. So let's go ahead and start with some of the local data and numbers. We continue to climb, but certainly at a very short amount. We've got a total of 82 cases right now in the county. And remember, those are cumulative cases since the beginning of COVID, and we've been tracking. 2 of those are actually presumptive cases. So we've got 80 positive cases total. Of those 82, 5 are active and 77 are inactive. We've got 5 of those folks are resting at home, which means we don't have anybody in the hospital right now, with 74 recovered and holding with 3 unfortunate deaths. So just another quick review of our epi curve here. So things are staying down here nice and low in this particular area, and that's a good place to be. Now, earlier this week, you may have seen a pretty substantial jump in this. I believe we had 10 cases that came out of the first weekend, or this last weekend, or the first weekend of phase 2. I can tell you that those cases were actually a good thing. While it may seem a little cautionary that it appears to be a significant jump, that jump was actually because of all the increased testing that the county's been doing in many of our vulnerable populations, to include our Latinx community. So those were actually found as part of our surveillance, which is a good thing, because early identification of folks who are positive for COVID that we're able to isolate and quarantine appropriately is what's going to help us with preventing the continuing spread of COVID. Testing, always a huge topic. You'll notice that we're starting to get some pretty sizable jumps now, with our total number of cases tested here and total number of positive. And that is attributed to just the ability of the county and their aggressiveness with doing asymptomatic surveillance testing in our community. So that's a really good thing to see. I was on a clinician call on Monday, and they actually had a couple of days over the last week that they were able to complete over 400 tests in a day. So that's awesome. And our regional goal is to be doing 500 tests a day. And we certainly have the capacity to do that. I've been asked a number of questions of how COVID-19 has been impacting the different communities here in Eugene. And I was able to pull this from the Lane County's website. And as we've seen across the nation, some of our vulnerable and communities of diversity, specifically like our Latinx community here, does have quite a bit larger proportion of representation with positive cases versus the population as compared to the non-Latinx population. If we look over here on the race side here, you can also see some of those numbers as they plan out here. Again, that information is available on the Lane County Public Health website if you'd like to look at that further. And then if you'd like to look at it from a state level, it's also available on the Oregon Health Authority's website. If you have any further questions on that, I'd be happy to answer that. Another quick question on testing has the protest, which started almost 2 weeks ago now, I think we're on day 10 or 11, did those have an impact on our rise? Again, according to the clinician call I was on Monday, we haven't had a positive case of COVID connected to the protests which have been going on here in our local area. So that's a good place to be, but remember, it can be the virus can sit out there for a little bit and might pop up later on. Now, taking it up to a 10,000 foot view, looking at the state's perspective, you'll notice things are looking pretty good in terms of our total cases. We did have a pretty substantial spike over here. If you're watching what's going on, what's happening is they've started reporting businesses that are showing clusters. So I believe it was businesses that have greater than 30 employees. They're starting to publish that data, and so a couple of those came out. There was a business up in the metropolitan area, Portland metropolitan area, that had a cluster of cases. But the one that's a little bit closer to home is the Pacific Seafood case over in Lincoln City in Lincoln County. And earlier this week, they actually came out with 124 positive cases, and that might actually be higher now since we've had a few more days to get results. And so a couple of things there. One, that's a little bit concerning considering Lincoln County has about 50,000 folks in population. So to have a significant jump like that is concerning. However, the good news is they're able to isolate it to that employer. So we use our isolation and quarantining to manage that piece. That's something that we really want to watch if that happened even nearer to our community, especially if you consider if that spike was from a facility, say in Florence. And when we start considering what we call in the emergency medical services community, we refer to as population migration. So when folks are like coming from the coast to work in the valley for the day and then they go home, or vice versa, or people going into vacation or recreate, or et cetera. We've got a pretty strong migration back and forth between Florence and the Eugene Springfield area. So that would be something that we would want to watch and be very cognizant of if that actually occurred in our particular area. So moving on, we opened into phase 2 last Friday. So we're actually only like 6 days into phase 2. But we're seeing the expansion of recreational sports and some venues open up like movie theaters, bowling alleys, et cetera. I know Furs Bowl over off of River Road was pretty excited, and they had their facility set up where it was every other lane. And the first night they opened up, they were packed. In fact, that was actually in the paper. We did get some guidance on pools, so certainly our recreation folks are taking a look at that, and our central services folks over in the employee resource unit have done a great job putting together what that plan for reopening some of our offices look like in a safe manner. We also see some increased gatherings with our social and civic based, faith-based folks. And then those bars and restaurants have started opening up a little bit more, as well as their hours have extended up to midnight. As of this morning, in fact, it was just a couple hours ago, we received the sector guidance for K through 12 and what that looks like for schools. So unfortunately, at the time of this report, I haven't had an opportunity to read that, but that information was released today by the governor's office. So, last week I talked about how we kept that curve flat, and we were able to move to phase 2. But we got to remember that we can be regressive, right? So if we had another one of those, for example, if we had a Pacific Foods type of incident and we weren't able to explain why or how that all occurred, that could put us into a regressive, so we could end up going back to phase 1 or to what they call baseline, which is where we were at before phase 1. So even though we're in phase 2, we have to continue to monitor and maintain, which the Lane County Public Health updates our data and the metrics that the state is looking. The state downloads that data on a weekly basis and then evaluates us to be able to stay in the phase we're in on a weekly basis. And that's going to continue. So we're still looking and have to maintain that our percent of ER visits with COVID-like illnesses stays low. We still want to see those declining hospital admissions or none. We continue to be in a good place. We're staying with the onesie twosies, the strong contract tracing. Lane County Public Health was actually hiring a couple of part-time nurses. They announced to make sure that they've got that in place if it did ever occur. Or the need occurred. So we needed that contract tracing to not only be timing, but also be adequate. And remember, we need to be able to trace those positive cases back to existing cases, because we don't want to be in a position to where we're starting to have community spread. We want to maintain adequate isolation and quarantine facilities. So we talked about that. Typically that's at home for folks, but we're also have the county has the facility on River Avenue now, which can take care of about 40 to 50 folks. We'll continue with testing, both surveillance and maintaining that surveillance. So Dr. Guzman certainly would get some credit for that over at Lane County Public Health and her efforts and her team to go out and do those things while we're maintaining and continue to increase our capacity. We want to maintain our healthcare capacity. So in terms of with the hospitals, in that we don't want the hospitals to be completely full. And if we get a surge, we have challenges or issues. and then always our sufficient PPE. So that's where we're at as we continue to move forward and stay in phase 2, and we anticipate staying in this phase for quite a while, because we're not going to go to phase 3, which is our highest risk, until we have a reliable treatment or a vaccine, and then we can start to see the reopening of some of our larger events and venues. And that's why at this point the governor has recommended the canceling of those types of events through September, because we're not going to be in that position yet. So this is where we're at for right now, which allows us to be in a bit of stabilization, and allows for our EOC, which coming up here in a few days will have been in operation for 3 months. So certainly a shout out to the entire EOC team, who's we've had folks who have been here the entire 3 months with me, and have worked hard and dedicated, and it's just been an amazing experience for them, and doing good work for the citizens of Eugene. So the emergency declaration for COVID expired yesterday on the 9th of June. The city manager elected at this point our recommendation to not renew it. We feel we're in a good place right now. And so we'll start moving staff back to the department. So over the last 3 months, we've actually had a total of 128 folks who have actually worked for the EOC, or moved through, or did an assignment, or what we call a tour. And our goal right now is by the end of late June is to be down to about 12 staff members working in the EOC. And the reason for that is, as I said before, is things could be regressive. So with those 12 employees, we refer to that as a warm EOC. And if something was to happen, we were able to reinitiate an emergency declaration if needed, and then staff the EOC back up to manage or deal with whatever emergency we may be faced with. So that's the reason with that, and that'll probably run for at least a couple more months, because they're also going to be looking out for, are we going to have a second wave in the fall. We've our outreach teams, so most of our outreach teams who have been working on this have been demobilized. And those teams will continue their work through their home department. So, these are folks like our downtown ambassadors, our park ambassadors, et cetera. And then certainly our street outreach teams, which I believe Brooke talked about with you all about on Monday night, working on those establishment of those microsites to transition our designated temporary shelter sites to those microsites. And we're going to support that effort as well. And then again, we've been starting to decommission some of the restrooms and hand washing stations. Our data-driven approach is utilization. We just simply have quite a number of them out there. Remember, we put out about 70 porta potties and about 50 hand washing stations, and some of them just aren't being utilized, or utilized very little. So we'll bring those back in. And then when it comes to our PPE, much of that has been pushed back, or is going back to the department level for our first responders. Eugene Springfield Fire Logistics will be monitoring and taking care of that. But the other departments will take care of their own. But my ending slide here, statement is, we're going to be in this place for quite a while. And interestingly enough, really a lot of the message since the beginning of this, of how we prevent the spread and ensure more of the quarantine of this disease, really hasn't changed. The staying home if you're sick. If you're at high risk, please be aware of that. Stay home. Even if you feel well, change up some of those practices or habits, practice good hygiene, cover those coughs and sneezes, etc. Physical distancing is still strongly in place with the associated use of some type of facial coverings. And, even for, while some of the travel bans or recommendations have been lifted, and I presume will continue to lift as we continue through this phase. This is the opportunity to maybe stay close, stay home, and maybe not have quite widespread of travel until we get into phase 3 or further along in this process. With that, as always, please feel free to reach out to me if you have any specific questions. I'd love to hear from you and answer those questions. And thanks again for flattening the curve, and let's continue to hold it. Have a great day.